I founded Hope Foundation for Women and Children of Bangladesh in 1999 with the desire to help poor people. I am from a town called Cox's Bazar in southern part of Bangladesh. I saw tremendous suffering there among the poor women and children, particularly in the rural areas. There are very few healthcare services available, and most are too expensive for this community. I saw mothers dying unnecessarily and suffering from childbirth-related injuries and other diseases that are preventable. I knew I wanted to help these women and the community, so I established Hope Hospital and our rural clinics to improve the health of the communities for years to come. Hope Foundation's objective is simple: to bring critical health care to women and children living in rural areas. Our biggest concern is improving maternal health in the area because healthy mothers means healthy families. We are working to reduce maternal and child mortality, to improve safe birth rates, and to prevent childbirth-related conditions like obstetric fistula. To reach these goals, we are working to expand our healthcare services to reach the most remote areas, to educate the community on healthcare practices, and to reshape their views on family health. From the beginning, we approached our work in a grassroots way. We work with the community to assess their needs, and that means we take their local culture into account. We also have 38 mothers clubs who disseminate information from Hope. They help us access women who are suffering and are not aware they can be treated, and they work to help their whole community seek a better quality of life. Hope's motto is that change needs to come from within the local community, never forced by external individuals. This helps the community trust us, and it gives us access to the most remote areas. At Hope, we understand that to truly improve community health, we need not only to provide much needed healthcare services, but also educate families and train the locals in healthcare related fields. Our midwifery program is meeting a desperate need for trained birth attendants. Currently, we are conducting an intense 3-year midwifery diploma program. Our goal is to build the capacity of these communities so that they can meet their own needs and grow in every aspect. To measure our success, we track the number of patients we see every year. We also look at our impact for specific conditions such as our number of obstetric fistula patients or cleft lip and palate patients. This shows us how many families are learning that their conditions are treatable and learning about Hope Foundation. The data on fistula is especially important because there are a substantial number of women in hiding. We have only regional estimates for how many people are suffering, and we compare that to how many we have served and how many new cases arise each year to measure our prevention methods. We also follow up and interview patients to monitor our qualitative success in changing lives. Many people are not aware that we have training and education programs in addition to healthcare services. Also, our services are charitable, but any individual is welcome to be treated at our facilities. Those who can afford to pay do so, and those who cannot either utilize our sliding scale fee system, or if they cannot pay at all, they can receive free services. We want to serve the entire community. What makes Hope a truly community-led organization is that we employ local staff, and this way we are continuously giving back to the community. I would say our achievements are in the numbers of people who receive services from our hospital and rural health centers. Every year, we perform hundreds of surgeries for fistula, cleft, and other conditions, provide prenatal care and safe delivery to thousands, provide counseling and nutrition, family planning, and treat an array of diseases. We also started a burn care program, which is a huge problem for rural women in Bangladesh. Since our founding, we have served nearly 500,000 patients. We have trained over 100 community health workers, and we have hosted over 200 international healthcare professionals as volunteers. And these numbers will continue to increase as we expand our programs. We have been working since 1999, but our biggest obstacle is lack of awareness for the work that we do. We do an immense amount of critical work on a tiny budget, but since many people don't know about HOPE, our private donations remain minimal. We desperately need to increase our donor base and attract new funders to reach out to more people in need. We have so many great ideas for some great projects if we had additional resources. My goal is to set up 50 midwifery stations in next 5 years, where we will employ our own midwives in rural areas so mothers can deliver their babies safely. Right now, we have over 1,500 pregnant mothers registered and wanting to receive antenatal care and safe delivery. We strive to help all these mothers but do lack the financial support. With additional funding, we also can perform more surgeries, initiate more training programs, and reach more women and children who are in need. Our biggest opportunities are in technology. We could set up electronic health record to collect health data more easily, share educational videos to uneducated groups through our mothers clubs, send text messages to women reminding them of their appointments, and much more. Maternity care also needs to be expanded, as it is so important in preventing serious life-threatening conditions. Technology could really help us to deliver the best care.